In women with endometriosis, endometrium-like tissues, that's tissues that's supposed to grow in the lining of the womb, found themselves outside of the womb. Endometriosis affects an estimated 190 million women globally, and they are all in their reproductive age bracket. Endometriosis is a chronic disease. Chronic means long-lasting disease. And symptoms include severe pain during menstruation. Sometimes, or most of the times, these pains do not go away even after menses has ended. Heavy menstrual bleeding, infertility, chronic pelvic pain, bloating, and nausea. It usually occurs in the pelvic area, but for some women, pain can be felt outside of this area. Endometriosis can also affect sexual intercourse. It can also affect bowel movement as well as urination. Endometriosis can also affect your mental health, anxiety, and depression. There is currently no cure for endometriosis. Access to early diagnosis and treatment is limited in most settings. The aim of treatment is to control symptoms and also reduce the impact of the endometriosis. The reason why they say endometriosis diagnosis is delayed is simply because it takes a lot to make that diagnosis. So when a client or a patient comes and the symptoms and signs are suggestive of endometriosis, the diagnosis is not made immediately. Investigations will be made, ultrasound will be done. Some patients may need some form of surgery to be able to make that diagnosis finally. Like I said earlier, the aim is to control. Yes, endometriosis affects fertility in many ways. Endometriosis is a form of chronic inflammation over a long time, and it forms scar tissues leading to adhesions in the reproductive area, the pelvic area generally. And with that, there may be problems with natural conception. So there are no existing treatments that cure the disease. Everybody knows that. And treatment varies. It depends on the severity, depends on the availability of medication, it depends on whether pregnancy is desired. So there are a lot of treatment modalities. There are other medications to mitigate, to reduce the effects of the endometriosis. But some of these medications also affect pregnancy hormones. If there's severe pain, we have to make your pain better at the expense of any fertility outcome in the future. At least get you okay first, then the issue of the fertility can come later when much stable. Women with endometriosis can conceive. I must say at this point that endometriosis is a spectrum. Severity varies from one patient to the other. In milder forms of endometriosis, following evaluation, the gynecologist will decide and be able to tell the patient, okay, your chances of conception is this. Yes, for certain patients struggling with endometriosis, fertility treatments such as ovulation induction, IUI, intrauterine insemination, IVF, in vitro fertilization, may be recommended at a point. Endometriosis is associated with infertility globally. 20 to 25% of women struggling with infertility have some degree of endometriosis. That will be all for this week. Till next week, we will continue to address your health and fertility concerns. Don't forget to subscribe and turn on your post notification button to get your updates on our new videos.